Hi, everybody. Welcome to Kickstart Conversations. I'm Kathy from Kickstart Physical Therapy in Tampa, and I'm here with Dr. Stephen Dell-Jones, acupuncturist, and you're also a nutritionist, an herbalist, and a doctor of Oriental medicine. Is that correct?
Yes,
Okay, and you have locations in both Tampa and Riverview.
right.
Okay, great. So, Dr. Dell-Jones, tell us a little bit about what you do, how you got into acupuncture, and a little bit about your day-to-day practice with acupuncture.
Well, I suppose I got into acupuncture because I was into health anyhow. I was always been one of the natural health persons, eating healthy, being vegetarian for a while, and I was also into Chinese things like Chinese martial arts. So, as an undergrad, when I studied nutrition at college, uh, we weren't really aware of Chinese medicine at that time. In the early '90s, Chinese medicine was not something that had was not we just weren't aware of it at that time. So I studied exercise physiology and nutrition, and then only later did I discover that field. And I went back to school to be an acupuncturist, doctor of Oriental medicine, and I've been doing that ever since. So I've been practicing for 13, almost 14 years now, and it's quite an interesting journey. I do acupuncture, meaning there's different styles of acupuncture. There's eight principle, there's Dr. Tan style, there's Dr. Tong's Master Tong style, and as well as other styles. And then I do a point injection therapy, where some acupuncturists have had extra training to do. We inject natural things, usually homeopathic compounds that can be used for various purposes. And then, of course, the herbal medicine, the Chinese herbal medicine, including all the various patent or herbal formulas, and there's thousands of them, as well as making custom formulas for patients. If I find a patient who needs herbal medicine and they don't fit into the patent box exactly, you get to know the patient and find out their needs, and then make a custom herbal formula for them. Herbal medicine is very interesting because there's so many things that you can do with them. There's so many herbs that can be used, and there's different combinations can address a lot of internal health problems. Everything from migraines to fertility and everything in between. So herbal medicine is actually one of the larger pillars of Chinese medicine.
Okay.
And then I also do some more modern things like cold laser. I use the cold laser in lieu of acupuncture at times. It can be used similar, just
If
with
someone's afraid of needles or
we use a
something,
laser
yeah.
instead of needles.
Hmm.
So
Okay,
there's that option too.
that's very good. Okay, what are the so you mentioned pillar? What are different pillars of acupuncture?
The main pillars of Chinese medicine
Hmm.
are acupuncture, herbal medicine, um, physical modalities like gua sha, cupping, moxibustion,
Hmm.
and then there's food therapy.
Okay.
So Chinese medicine has always had its own view of nutrition, whereas instead of looking at micro and macronutrients, they look at the qualities of foods. If foods are just like with herbs, they may be warming or cooling, moistening or drying. They may nourish yin or yang.
Hmm.
So different foods have different properties, and using the right foods for the right patient's needs is also a therapeutic approach.
Very cool. So I guess what comes to mind is some of the autoimmune conditions, and they say that gut health is very important. Is that something that the Chinese medicine would address?
It does. Acupuncture can be helpful for autoimmune disorders
Mm.
because regulates the way that the body's immune system reacts or doesn't react. Um, and then in conjunction, a slightly more modern version of that to address autoimmune would be functional medicine testing. That's another thing that I do is I'll use GI panels to find out what is off internally, and food sensitivity panels to find out which foods are causing an immune reaction to the patient, which can lead to eating the foods that you have a problem with, that you have an immune response to, can cause everything from chronic stomach ache to chronic headaches to skin issues. So basically, using functional medicine, you can address the reasons why
Hmm.
autoimmune disorders develop.
Right. Wow, that's pretty interesting. Do you find that a lot of that is genetics, or more, what we eat, just sort of like a cultural thing, I would say.
I would say that a lot of it is dietary. A lot of it
Dietary.
is what we eat, and also chemical insults that people have in their
Hmm.
life. Like people don't realize that certain medications and certain like heavy use of antibiotics seems to be uh, a contributing factor to chronic internal health issues later on in life.
Okay. Is that sort of like the biome that everybody's talking about?
Definitely affects the biome.
Yeah.
Yeah, the biome is reflective of our overall health. And when someone's biome is off from having had uh, too much harmful exposures in their life, then other issues seem to arise.
Right. Okay. So it's like a cumulative effect in a way.
It certainly seems like it can be.
Yeah, I'm noticing there's a lot of diseases that are popping up that never were, sort of like younger people having colon cancer, that what didn't seem to be the case. And so I think that, do you think that that is something that you've seen, or are you sort of monitoring that?
I've seen people who are in their 30s who have a variety. Whenever I see someone who's relatively young and they have a Pandora's box, it seems like it goes back to very consistent antibiotic use as a child.
Okay. Oh,
So I have this notion that modern problems require modern solutions. So that's why I use the functional medicine, or at least I have that in the back of my mind when I'm talking to someone. Do they seem like someone who would benefit from this type of investigating?
okay. What about structural issues? Because as a physical therapist, we deal a lot with the spine, or, different joints in the body. How do you kind of approach that from the Chinese medicine standpoint?
For spinal issues and back pain and things like that. Yeah, the classic methods, the gua sha and cupping are very important. Gua sha is using a tool is scraping. So my
Okay.
understanding is now they call it scraping, but originally it was gua sha. Okay,
Yeah.
so gua sha and cupping are helpful. You have to know what sections to apply that, as well as acupuncture and honestly, point injection therapy. The point injection therapy I do is designed to be very beneficial for connective tissue. So whether there's a bulging disc, whether there's ligamentous sprain, it's important to use the right tools. So and I've been treating back pain all 14 years, and I think that some of the the harder cases, usually benefit from the point injection therapy.
Oh, great.
Um,
Yeah.
yeah,
And
yeah.
I also see a lot of cupping on some of the athletes that I work with, or including performers like dancers. They tend to like the cupping, so you could see that they have all the little marks all over them, like, oh, you just had cupping done. So I feel,
Mhm.
is that the same type of cupping that you're
Yeah,
talking
it
about?
is.
Okay.
Yeah,
Okay.
cupping can be done with they now have like a plastic cup where there's a piston, so it
Mm-hmm.
can be done the modern ways with the piston,
Mm-hmm.
the old-fashioned ways with a glass cup
All
and
right.
fire.
And
So
yeah,
I do
so
the fire cupping because it's just what I did in school. It's just
hmm,
very once you get used to it, it's just very easy. You know,
yeah. Does that feel like there a warming effect for the
the
patient,
cups
or
the cup shouldn't actually get warm.
no?
If
Okay.
the cup is warm, you've delayed a little bit. The hand should be quick enough that there isn't heat.
Got
It's
it.
just a
Okay.
vacuum. But
Okay.
but you,
Okay.
you make the vacuum. The heat is just to burn oxygen.
Okay.
The fire is
Okay.
to burn oxygen.
Yeah, so
Yeah.
it pulls the oxygen out of the cup, so it pulls the skin up. Is
And
that
then
sort of
and
in
then you
the
have the
tissue?
suction, which is a massage. Instead of pressing
Mm-hmm.
down, it's pulling up,
Mm-hmm.
so that it moves fluid through the fascia. It moves fluid through the underlying muscle. So you're creating an effect where you're doing massage by pulling upward instead of pressing inward.
Mm-hmm.
But it's a very deep type of deep tissue massage.
It's so interesting how you can do either or, where the myofascial release and is actually putting pressure in, and then the cupping is actually pulling pressure out, so they can both be beneficial for the patient.
Yeah.
It's quite interesting. So how did you get into this? Did you just, say, okay, well, I'm going to go through the exercise, science route, and what sparked your interest?
Actually, I myself had a sports injury,
Okay.
and then when I got acupuncture for it, I just thought that was the most amazing experience. So I got acupuncture a few times, and then that lit a fuse, and then so that notion was now there in my back of my head, and I had to go. I think about like a year later, I was back in school for
Yeah.
acupuncture.
Okay. And that was your path.
Yeah,
So here you are.
yeah.
Very good. So I guess I should just kind of pull a diagnosis out of the hat. Let's just say rotator cuff, because I know you and I were talking about that earlier. Um, the approach to rotator cuff, I think, how would you tend to look at that type of thing?
So, well, someone has shoulder pain, I do like a couple of basic tests to see if I can narrow down where it is. Sometimes people come to me with an MRI report. So if they, usually for their back, like they have an MRI for their back.
Mm-hmm.
Most people have had back pain for too long before they actually show up to see me. So they have an MRI. But if they have an MRI for their shoulder or not, then that gives us clues as to which tissues are the problem areas. So we can use cupping for that as well
Mm-hmm.
as acupuncture. Um, and I have used point injection therapy for that because, as you can guess, rotator cuff injuries are a little annoying, a little slower, and of course painful. So the point injection therapy is is an extra step, but it's usually worth it for that.
Right. Okay. And it's pretty common. It can either be degenerative or it can be like an event that happens where somebody, for instance, in sports, or they might be reaching back to grab something, and all of a sudden, there's the rotator cuff injury. It was just micro trauma over time, and then it just shows up. Or they could have had some kind of injury where they fell or they grabbed something, and then it's more of a traumatic type of thing. So of course we see that a lot of times in physical therapy. How can physical therapy and Chinese medicine pair together to for something like that, for example?
I think it should because I have people who come to me who can't move. They're in too much pain and they can't move. So acupuncture can help reduce the pain and increase their range of motion. And then they need to follow through with physical therapy to truly rehab that joint. So sometimes they're put into physical therapy directly, but I've had patients tell me that they couldn't do it. It was too painful to do it. They couldn't even really start. So it seems to me like they should we should reduce their pain and get them to where they can move it a little bit better, and then do the physical therapy where that'll behoove them more because now they're able to do the prescribed exercises better. They can actually move their joint better. So
Okay,
that
nice.
that would work better.
Yeah. What about wellness? I know that we're talking a lot about some of the conditions that are ailing people. What about things like wellness? Does anybody just say, "Oh my goodness, my muscles are so tight, I just can't take it anymore. I need to go see my acupuncturist."
Tight muscles. No, actually,
No.
I don't hear that a lot. People talk about tight muscles, and it's often related to stress. In the Chinese viewpoint, it can be related to liver qi stagnation. So, like when it's in the upper back and the shoulders, it can be related to something that's more internal.
Mm-hmm.
So I tend to address things not just on the meat, but on the person. Do they also have the wiry pulse? Do they also have headaches? Do they also have fatigue? Do they also have other signs of liver qi constraints that would possibly cause them to have chronic tension? Um, so that's one way of looking at it. And one of the advantages of Chinese medicine is you look at the person, and then each symptom is just a um, one aspect of a syndrome.
Okay.
So
Yeah.
so there's ways to look at that. But to answer your question, not enough people come in for wellness. People come in when something hurts too much to move it, or they can't sleep, or they have headaches.
Right.
They come in for when they can't do life as well as they need to because of pain. Then they come in.
Yes. Yes. Okay. That makes sense. Is there anything else that you wanted to highlight about your practice and what you do, or maybe some advice for some of our listeners and watchers?
Yeah, I would like to let people know that acupuncture and or Chinese herbal medicine can be used to address a lot of things that they're often not aware of. Some of the things that are stand out off the top of my head would be like painful bladder syndrome. I've been able to treat painful bladder syndrome in a couple sessions, where someone has dramatic improvement, and most people may not, I mention it because most people may not realize that they could get that type of improvement so soon in a handful
Yeah.
of sessions, that they could have something that is a vast improvement from where they started.
Hmm.
Things like trigeminal neuralgia, you wouldn't think, but acupuncture can address trigeminal neuralgia very, very efficiently. Also, and that's another thing, within a handful of sessions. I have the 1-3-5-10 idea in the back of my mind, where someone talks to me, I see what's going on. If they have a back sprain, probably one session. If they have something a little bit more, maybe 3 sessions. If they have trigeminal neuralgia, maybe 5 sessions.
Ah.
So I kind of think of each person as they're telling me everything that's going on. I kind of think of them as a 1-3-5 or 10. Like
Okay.
how long does it take for them to get better?
Right, right.
And even things like very painful bladder syndrome that someone's had for years can really even be just 5 sessions.
That could be pretty debilitating.
Yeah.
Yeah, yeah.
Everything from migraines to carpal tunnel, tarsal tunnel, knee pain, any pain that can be had on the body, from ulnar entrapment to ankle sprains, and any joint pain can be treated with acupuncture.
Right. Yeah.
So
Well, I love the fact that we're both very passionate, and our fields are so passionate about helping people. And I think that's the number one thing, is really just helping as many people as we possibly can,
yeah,
to get better and live their best lives.
yeah.
So, yeah. Well,
Yeah.
any final thoughts or?
Uh, Thank you very much for this
Oh,
opportunity.
yeah,
Yeah,
absolutely.
thank you
Yeah.
for the opportunity. And
Well, if anybody needs help, Dr. Steve is here, and and if you need the physical therapy, come on in and we can help you together if needed as well.
yeah,
So yeah, well, thanks everybody for coming, and we'll see you soon.
thank you for listening.
Okay, bye bye.